The State Department of Health is recommending medical providers in Tennessee prioritize who receives the monoclonal antibody treatment due to the limited availability of that treatment here. As State Capitol reporter Gerald Harris tells us now, this comes as Tennessee has faced intense community spread of COVID-19 and a low vaccination rate.
Monoclonal antibody therapies, which has an emergency use authorization, is used to prevent hospitalization and severe disease in COVID-19 positive patients, and it's running thin here in Tennessee.
And I think that does reflect the fact that here in Tennessee, we have relatively low vaccination rates. And so I think the State Health Department is trying to triage these supplies to locations that would be most beneficial.
The Tennessee Department of Health is recommending healthcare providers weigh who really needs the treatment with those who can live without it, especially in the first few days of infection.
Certainly age, anything that can impair the immune system, diabetes, larger body mass index, or patients who are obese or overweight.
This includes guidance to prioritize the treatment of those who are most likely to be hospitalized, the unvaccinated, who are 11 times more likely to die than vaccinated individuals.
Because that's a pretty sobering statistic. And so again, I think with that in mind, that anything we can do to prevent hospitalizations and people from becoming critically ill or even dying is really crucial at this point.
In a statement sent to News 2, the Department of Health says ultimately this comes down to providers' clinical judgment to ensure those most at risk are receiving this treatment. Dr. Block says the best thing you could do to prevent infection in the first place is to get vaccinated.
And the vaccine is given before people ever get infected, and it really prevents folks from getting sick. This is a salvage therapy, and it's a great option for folks who have mild to moderate illness. But again, some small proportion of those are going to continue to become more ill and require hospitalization.
44% of Tennesseans are fully vaccinated. In Asheville, I'm Gerald Harris.
Now, despite supply concerns for monoclonal antibodies, the Department of Health says that, quote, providers across the state continue to receive supply of the treatment. However, they do not have an update on allocation for this week. Well,